Hi, and welcome to COVID Vaccine Facts and Fiction, Episode 3. I'm here again with Dr. Joel Kaye, and we have a bunch of questions to discuss about COVID vaccination, about what's happening here in Israel. And one of the things that we could start with is, let's look at how many people have been vaccinated so far in Israel and who's being vaccinated.
So, hi, Avram. Nice to chat again. A couple of things just before we dive in. First of all, I would like to dedicate this talk to the memory of my wife's cousin, Dganit Glick, who passed away 1 year ago from flu complications, believe it or not. 40 years old, and she left behind a husband and 5 children. Flu vaccines are available. People should get them. Flu is a killer. People die. And tonight I'll be going to the memorial from someone who died of flu. The second thing I just want to say is that I've gotten some feedback. You've gotten some feedback. People say that the title might be confusing. I just want to start and say, go and get the vaccine. If you can, go and get it. Just so we're very clear. We're very pro. The numbers. You asked about the numbers. Let's put the script. This is the data from the Our World tracker. You can see Israel here in terms of total numbers of vaccines is up to 1.8 million as of yesterday. 1.8 million people have already gotten their first. Some people are already starting to get their second vaccinations. Some data that came out today from the Israeli Ministry of Health has shown that over 60-year-olds in Israel, 72% of them have received their vaccine. From 70 to 79-year-olds, 81% have gotten their vaccine, and people over the age of 80 are at 76%. So these are amazing numbers. We are reaching, almost all people over the age of 60 have already gotten, and if not, we'll be getting very soon. So we should hit, huge numbers in those populations very soon.
Okay, that's very impressive. That we are ahead of the UK and in terms of absolute numbers, according to what you just showed. So not only are our relative numbers high, but even the absolute numbers are rather high, looking at when comparing Israel to other countries that are even bigger in size. You had mentioned that people got the second vaccine already. I saw on the news that Prime Minister Benjamin Netanyahu got his second dose. He was one of the first people to be vaccinated. He's around 70, I believe, or even over 70. So he's definitely eligible for that. And he got his second dose. Another thing that was in the news was the fact that Prime Minister Benjamin Netanyahu struck a deal with Pfizer. And that deal involved Israel giving some data to Pfizer. And in exchange for that, getting more shipments, advanced shipments of vaccines in order to vaccinate the entire country, enough vaccines to vaccinate the entire country. So my question is, what are we giving up here in Israel? What Israeli citizens are, what's this data? Are rights to privacy being violated? Who's going to be looking at this data? Should we be concerned about that?
Okay, so I don't know if it was just the Prime Minister or together with the Ministry of Health. As we mentioned in the last episode, we said that there were 3 theories as to how Israel was getting the Pfizer vaccines. And one of them at the time was that this was a pilot program where you have a very quick rollout in a relatively small population in a highly digitalized environment where you have digital records from patients, and the HMOs, the Kupot, have the ability to track what's going on. So that still makes sense. The deal that was struck gives the data to Pfizer. This gives the data de-identified. It's very important that we discuss that. What does that mean? There is no personal information of your Taudat Zahut, your equivalent of a social security number. There is no information beyond age, sex, health conditions, prior health conditions, when you got the vaccine, if you've ever had a COVID test, when you have the COVID test, etc. People need to understand that de-identified data like this stuff gets shared in agreements all the time. These are large sets of data that can get analyzed. People that develop digital health mechanisms to track, for example, symptoms of heart disease. For example, IBM is a company that tries to develop software that can go through the data and look for trends and try and diagnose. And that is done by using all of these large pieces of data, and these are all done under agreement. So this is not new, and it's certainly, to me, not shocking. I don't think people need to be worried that their privacy has been exposed. It hasn't. Again, this is de-identified data. And again, it shows that because of the high level of digital health in the country and access to patient history and data, this will allow you to track people who got 1 injection versus 2 injections, the number of infections that they had, together with contact tracing that happens. You know, if there's an outbreak, is there an outbreak in an area of a person that got a vaccine? Could they have transmitted it? That's incredible data that we could gather and publish and learn from. So it seems like a win-win.
Okay, that sounds great. I mean, I've learned and been involved with digital health initiatives for the last probably at least 10 years. And I never really thought of it this way, as something that can be potentially saving lives. And essentially, Israel was moved ahead and was preferred for vaccination, at least by Pfizer, because of this tracking, because of its ability to maintain good digital health records. So I think that's important. That gives us another viewpoint on the importance of digitalizing health records. So one question that people have asked me is as follows. I'm a healthy guy. You know, I run marathons. I'm under 60. I'm in my 40s. Eat well. I'm pretty much low risk. Why should I personally get this vaccine? I can understand why my, parents, in-laws, grandparents, I can understand why that, people over 60, higher risk, but why me?
Okay. So first of all, that's a great question. So this brings us to a concept that people talk about called herd immunity or community immunity. When we're talking about infectious diseases, whether it's COVID or measles or mumps or flu or whatever it may be, in order to stop transmission of infection, you need to have the population, the general population, immunized. There are 2 ways of getting immunity. One would be natural infection. The other would be vaccination or immunization. Now, obviously, it's slightly different from country to country. But given the fact that roughly 0.2% of the population are dying from COVID, 0.2 of the population that's infected are dying, if you were to do herd or community immunity in Israel through natural infection, that would result in, 70, 80, or 90,000 deaths. How do we calculate that number? There is only an estimate of what's need for herd immunity with COVID. The numbers that get thrown around are 60 to 80% of the population would have to have immunity in order to stop the transmission. That means if you would do that by natural infection, if you do the calculation of the numbers, you get to about 70,000 deaths, which I don't think anybody would accept as a number you would want to get to through natural infection. The other way to do that is to vaccinate.
Let's just break down those numbers for a second. We're talking about getting to, Israel population is around 9 million. So let's say half of those people need to get infected in order to get to natural immunity. So we're talking about 5 million. And you're talking about deaths of about 70,000 based on that number of 5 million or so people, right?
Something like that, yeah.
And currently the death toll from the beginning of the pandemic is about 3,500. So it would be a 20-fold increase, pretty much.
Right.
And so that's definitely does not sound as acceptable.
Doesn't sound acceptable to me. I mean, I don't think 3,500 deaths is acceptable, but we're certainly doing better than other places. So when we talk about vaccination, you want to hit that herd immunity or community immunity of 60 to 80% coverage. So that would mean that a healthy 40-year-old marathon running guy that eats well and has social responsibility to those other people that are at risk, elderly people or people with other background conditions, you would step up and you would be part of that herd that's getting the immunity, because the more people that are immune, the less transmission you have of the virus. Eventually, there'll be data that will show, probably, maybe, that it stops transmission. That's the whole idea. Life goes back to normal. We don't need to have the whole lockdowns. We don't have the social distancing, the masks. This is going to be something that'll be under control. So that's the only reason I can see why someone would want to do that, obviously. You also don't want to get COVID. I mean, you might get it easy. You might have a few days of not feeling well, but you might be one of those patients that goes downhill very quickly and lands up on an incubator in hospital and never sees their family again. I mean, I don't understand wanting to get a disease that can kill you. So that would be the other reason.
Right. Okay. I mean, that what you're saying makes sense. And I think that people have this conception about COVID being a disease that only inflicts the elderly, but it's really not the case. At least the Israeli Medical Association came out with some statistics about that, and looked at how many people are become seriously ill from COVID, and they found that 30% are under 60. So, and I think those numbers are even going up now.
The flip side of that is more and more data is coming out showing long-term effects of getting the virus. Long-term effects on the respiratory system, on your heart. People are suffering months and months after they got the virus, even if they were asymptomatic and even if they got it very mildly. This is not a virus that plays necessarily by rules of what we know about viral infection. It's only been around for a year. We're learning more and more. It's not a walk in the park. It's not the number that people say. This is not a disease that you would lock down with 99.8% survival, because it's not the 99.8% survival you need to worry about. It's the 0.2% deaths, and it's the long-term effects of the infection that you would need to worry about. So it is what it is.
All right. Another question that we can address, maybe this last question here for this episode. Let's talk about women, pregnant age or pregnant women. Should they vaccinate? I've been asked this question. Does the COVID vaccine impact fertility? There's been talk that it's going to impact fertility, cause problems for women that are pregnant or becoming pregnant. Can you address that?
Yeah, I will try to. So let's start with the fact that pregnant women were excluded from the studies, both by Pfizer and Moderna. Having said that, people on the studies got pregnant and they are being followed. Nothing's happened to them so far. Since approval, the FDA, CDC, the American College of Obstetricians and Gynecologists have come out with recommendation that pregnant and breastfeeding women get the vaccine. Biologically, there is nothing to be concerned about. The mRNA gets broken down at the site of injection. It's not going to reach the placenta. It's not going to cross the placenta. It's not going to reach the fetus. It's certainly not going to reach milk of a breastfeeding mother. What is it going to do? It's going to induce an immune response. So let me focus on the breastfeeding. All immunity given to a fetus is through the mother's antibodies. So if the mother makes antibodies against COVID as a result of vaccination, she protects the fetus. When the baby is born, those antibodies probably cross over to the milk, like all antibodies that are studied for other viral infections. And for the first year during breastfeeding, the mother would protect the baby. So there is no immune system in the fetus. You're not going to, even if the mRNA were to cross over, it wouldn't induce an immune response. There would be nothing there to worry about. All I can show you is, just as an example, here is a post on Facebook from a great a scientist who has a group called a page called Your Local Epidemiologist. And in her post, she goes through all of the recommendations and all of the science. But I think pictures speak more than words. This is a picture of her, very pregnant, getting the vaccine a couple of days ago. So not only has she broken down the science and looked at the recommendations, she went and did it herself, and she is showing the world that there should be nothing to worry about if you're pregnant and you can get the vaccine.
So how about claims that people have made regarding the dangers to the placenta? And where does that come from?
So there has been a theory running around the internet that says there is some shared epitopes or shared protein structure between the spike protein of the mRNA vaccine and the virus and a placental protein. You know, we could spend 2 hours talking about the science behind this. The bottom line is there is no basis to it whatsoever. In order for a cross-reactivity to occur, you would have to have almost out of 9 amino acids that are important, you would have to have many of them be an exact match, which they aren't. You would have to have the right ones binding on the one side to something that's called the MHC and the other side that binds to the T cells in order to get that cross-reactivity. The likelihood is zero, literally zero. There is no basis to the claim whatsoever of cross-reactivity to the placenta and inducing some issue with placental loss or loss to the baby because the immune system attacks the placenta.
Okay, thanks, Joel. I think our time is just about up. And I appreciate you taking the time to talk with me about these important questions. I think the fact that people are listening and the fact that you're getting the word out about how to save lives is important and is also contributing to the memory of your wife's cousin. And I'm hoping that people learn from this and understand the importance of the pandemic that we're in and appreciate the gift that we have to be able to vaccinate.
Yep. Thank you for interviewing us, both of us.
All right. Have a good evening.
Thank you.